Surgery, Bloomfield Hills, Michigan. So this is a nice, interesting case. 36-year-old patient, only 36. She has a set of implants, saline, below the muscle from the year 2012. So she had what was significant ptosis bottoming out of what are relatively very average implants for her chest width and her height. And as you will see, there was a lot of contouring that I did, a lot of this 100% total capsulectomy, 11326 initials JB. And so as you can see, a lot of contouring, fatty tissue that I removed in order to balance the two out. The distance from the nipple down to the new inframammary crease is 8 centimeters, and this was maintained on the left as well. And as you can see over here on the left side, a lot more skin removed because she had the severe ptosis and the asymmetry in order to balance the two out. So the breast tissue was not touched on the right or also on the left. The entire dissection was done below the muscle. And number two, the distance from the nipple to the inframammary crease was maintained at 8 centimeters to make them symmetric. So as you can see, relatively thin capsular tissue, some areas thick. I'm going to go in from here. These are the saline implants. And you can see right here, the capsule is so thin, you can actually see as I cut through, no matter how thin the capsule is, it has to be entirely definitively removed in my practice, so there's no second guessing the process. No matter how thin it is, it has to be completely removed. And as you will see right here, the entire capsular tissue is removed and some fluid on the back. So as I take it, you will see, look at that stickiness, and that's that leaching of that silicone from the silicone shell of the saline implant. This is your Mentor 275 slightly overfilled implant, and you will see the capsular tissue right here that's relatively thin, some areas of fatty tissue. The entirety of the implant capsule has been removed completely definitively. So we're going to leave it right here. I'm going to remove my top sterile glove, and now we have what is a left side, and again significant contouring. As you can see, a lot of tissue removed in order to balance the two out. If you look at the volume of this in the capsule, is actually more than the volume of the implant. And so as I cut this out, remember it was intentionally done so as to elevate, lift, and normalize the right and the left. The left side was larger. So I removed a little bit more fatty tissue from the side. Remember, the breast tissue was not touched at all. And as I cut this open, you can see relatively very thin capsular tissue. The entirety of the capsule has been removed. You have to see the video of the chest wall. That is ultimately the video to see, not this one, in order to 100% sure that the whole capsule was indeed very much removed. And as you can see, as I pull this out, very slippery in the back. And you can see right here, the entirety of this implant capsule has been removed. And if I see this, you look at this. Very slippery. This is your 275 Mentor saline implant below the muscle. And look at this capsular tissue again, very, very thin. You can see my glove completely, sincerely, definitively removed, along with anything inflamed, abnormal, such that this fatty tissue that you're seeing, the back of it, all of it has been removed. And again, you have to see the picture and the video of the chest wall showing complete removal of the capsule, because that's the ultimate proof. And certainly with this video as well. So significant contouring of the right and left chest breast area, significant ptosis of the breast. We'll see how the skin recoils. I measured the distance from the sternal notch down to the nipple areola on the right was 28 centimeters, and on the left was 29 centimeters. And so we will see where and how she's going to be in the clinic as her tissue recoils with the excess skin removed, with the implant that's gravitating the breast tissue down. We will see how her 36-year-old skin is going to recoil, especially given the small implants. She is certainly only going to be looking better aesthetically over the next 3, 6, 9 months up to a year and a half. So between the recoil of the skin, Now that the implant is removed, that is gravitating the breast tissue down. Between the fluffing effect, now that the implant is gone, the breast tissue is going to get a chance to kind of fluff out. Anytime you have an implant in the proximity of the breast tissue atrophies. Number 3, you have some sort of a concavity effect because of the way the implant was sitting on the chest, and there is a contour deficit as a result of the rib being compressed down. Number 4, she's going to eventually work out and she's going to add muscle mass, that 5, 10, 15% muscle mass that she's going to add, and certainly the pseudo lift where the fatty tissue was removed and the breast tissue was medialized and lifted up. All of this with the inflammation subsiding. Number 6, you will see aesthetically the patient's only going to be very pleased compared to where she was, minus the unnecessary cut around the nipple and unnecessary cut up and down. Her previous surgeon cut at the bottom and the inframammary crease. I did not cut around the nipple or up and down, so her breast tissue essentially has not been touched at all, and that's how it should be, especially in a case like this. So the implants will be returned to the patient, capsules to be sent to pathology, rule out the rare BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. And most importantly, we'll see how the patient does post-op minus these toxins. And again, one last look. You can see, look at the volume of this skin excess, and the volume of the capsule is more than the volume of the implant. And you can see she's going to have a significant rebound of the skin and aesthetic enhancement of the breast tissue minus these toxins, without any unnecessary mastopexy, a lollipop cut, or a cut around the nipple or areola. This is Dr. Khan, Executive Plastic Surgeon.